Did you know that millions of men over 60 are inflaming their prostates every day without even realizing it? And what's even more alarming, this inflammation could be coming from innocent habits in your daily routine. Hello, my name is Dr. William Tharnell, a specialist in elderly health with over 25 years of experience in geriatrics and integrative medicine. And today, I need to issue a serious warning to you, especially if you're over 60. Prostate inflammation doesn't happen overnight. It develops slowly, fueled by common habits that most seniors don't even realize are harmful. The result? Pain, difficulty urinating, sleepless nights, an increased risk of infections, and in many cases, a silent path toward much more serious problems, like prostate cancer. That's why, in this video, I'm going to open the eyes of men like you and show you exactly what's happening inside your body, and more importantly, how you can stop this process right now. But before anything else, subscribe to the channel, hit the notification bell, and share this video with other friends your age. Your action could save lives. Let's get to the warning that every man over 60 needs to hear. Imagine a man named George, 68 years old. He lives a quiet life, enjoys gardening, has his coffee every morning, and rarely misses his Wednesday bowling nights with friends. But lately, George has been feeling something strange. He wakes up multiple times at night to urinate. His stream seems weaker. Sometimes, he even feels an uncomfortable pressure in his lower abdomen. He thinks, it must be age. But the truth is, George is experiencing the first signs of an inflamed prostate, and he's not alone. International studies show that over 50% of men over 60 already have some degree of benign prostatic hyperplasia, BPH, and most don't even suspect it. That's because the symptoms start subtly, silently, and are easily mistaken for normal aging. Prostate inflammation is like a slow-burning fire. It doesn't hurt at first, but it gradually erodes your quality of life. It affects your sleep, your mood, your sex life, and over time, it can progress to serious conditions. And do you know what's even more shocking? In many cases, the cause isn't genetics. It's everyday habits that could be avoided. That's why you need to keep watching. In this video, I'll reveal what's behind this inflammation and how you can act before it's too late. Before we continue, allow me to introduce myself more personally. I'm Dr. William Tharnell, a physician with a long career in elderly health. Over the past 25 years, I've closely followed the challenges faced by men and women over 60, both in clinics and through home visits and preventive health programs. Throughout my career, I've treated thousands of elderly patients in the United States, and I can say with absolute certainty, most of the prostate problems we face could be avoided with the right information, simple actions, and early attention. My mission has always been clear: to help seniors live longer and better, with independence, quality, and dignity. And in recent years, I've decided to expand this mission beyond the clinic by creating content like this, clear, accessible, and directly aimed at you, who are aging and want to preserve your health as naturally as possible. Prostate inflammation is one of the topics I've studied and fought the most. And what I've discovered is concerning. There's a silent pattern of destruction happening in the lives of many men. A pattern that repeats in George, Robert, Henry, Charles, ordinary men who just want peace and health but are being harmed by small habits with enormous consequences. My role here isn't to scare you but to warn you responsibly and with empathy. You deserve to know the truth, and that's what you'll get now. It's astounding how a simple gesture, repeated every day, can trigger chronic prostate inflammation, and almost no one talks about it. Let's imagine Robert, 72 years old. Every morning, he wakes up, drinks strong coffee, reads the newspaper, and holds his urine for hours. He doesn't want to interrupt his reading or get up multiple times. This seemingly harmless behavior has been going on for decades. The problem is, this simple habit, frequently holding in urine, puts continuous pressure on the bladder and prostate. Over time, this can cause urinary stagnation, increasing the risk of infections and directly inflaming prostate tissues. And that's not all. Urology studies show that men who frequently delay urination have a higher risk of developing benign prostatic hyperplasia and bladder emptying difficulties, leading to more retention, more pressure, and more inflammation. This is just one example of a common yet highly damaging behavior. And maybe you're doing it too without realizing it. The good news is that there are ways to reverse this pattern with simple actions, and we'll get there. But first, it's crucial to understand the signals your body is sending, even if they seem normal for your age. When I hear patients like Charles, 70, saying things like, "It's normal to wake up 3 times a night to pee, right, doc?" Or, "My stream is weak, but that's just part of aging." But no, that's not normal. These are clear signs that something is wrong with the prostate, and most men only realize it when the problem has already worsened. Here are the most common symptoms of prostate inflammation that are often downplayed or ignored. Increased urinary frequency, especially at night. Urinary urgency, feeling like you have to rush to the bathroom. Weak or intermittent urine stream. Feeling like your bladder isn't completely empty. Discomfort in the lower abdomen or perineum. In some cases, even mild but persistent lower back pain. These symptoms don't all appear at once. They settle in gradually, as if trying not to bother you, which is exactly why they're so dangerous. Because by the time a man finally seeks help, his prostate has often been inflamed for years and may have grown enough to compress the urethra and seriously impair urinary flow. The message here is simple: aging doesn't mean living with urinary suffering. These signs are your body's cry for help, and the sooner you listen, the easier it will be to regain your quality of life. Untreated prostate inflammation is like a silent time bomb. It grows inside you, slowly, until it reaches a point where the damage is no longer reversible. Let's talk about Henry, 75. For years, he ignored the signs, waking up at night, struggling to urinate, but thinking it was all normal. Until one day, he simply couldn't urinate at all. He was rushed to the hospital in severe pain and needed emergency catheterization. This is one of the most common scenarios in urological emergency rooms. Men who neglected inflammation and developed acute urinary retention, an extremely painful condition requiring immediate intervention. But it doesn't stop there. Chronic prostate inflammation can lead to recurrent urinary tract infections, bladder stones, kidney damage due to urine reflux, and, in more severe cases, an increased risk of prostate cancer. A study published in the World Journal of Urology highlighted that chronic prostate inflammation may be linked to cellular changes that, over time, favor the development of tumors. While not all inflammation leads to cancer, the risk increases significantly in those who ignore the problem for years. The good news? Most of these scenarios are preventable with the right information, action, and prevention. You don't have to, and shouldn't, wait for the worst to happen before taking action. Few people pay attention, but the way you urinate says a lot about your prostate health. When the prostate is inflamed or enlarged, it begins to press on the urethra, the tube through which urine passes. This completely changes the pattern of your urine stream. And here's the key point: your body warns you in advance, but these signals are often ignored. Pay attention if you notice any of the following when urinating. Is your stream weaker than it used to be? Are there pauses or interruptions in the flow, as if the urine gets stuck? Do you need to strain your abdomen to urinate? Do you feel like your bladder isn't completely empty, even after urinating? Do you feel the need to urinate again just minutes later? These symptoms indicate that the prostate is interfering with urine flow, something that shouldn't be dismissed as just part of aging. Additionally, urinary frequency is another red flag. Waking up more than twice a night to urinate isn't just a sleep nuisance. It's a sign that your bladder is being irritated, likely by prostate inflammation. It's as if your body is saying, "Something's wrong here. Pay attention." And the sooner you listen to this warning, the simpler and more effective treatment will be. Your urine doesn't lie. It's one of your body's most honest voices. One of the biggest misconceptions I hear in my practice is, "Doc, my dad had prostate problems, so it's genetic, nothing I can do, right?" This idea is dangerous, and unfortunately, very common. While genetics do play a role in many health conditions, including prostate health, they're not a life sentence. What really determines whether inflammation worsens or not are your lifestyle habits, not just the genes you inherited. Research published in journals like European Urology shows that environmental and behavioral factors have a much greater impact on the development of benign prostatic hyperplasia and chronic inflammation than family predisposition alone. Consider this: two brothers with the same genetic background can have completely different outcomes. One eats well, exercises, maintains a healthy weight, urinates regularly, and avoids inflammatory substances. The other is sedentary, eats processed foods, holds in urine, and abuses caffeine. Who do you think will suffer from prostate issues sooner? Genetics set the stage, but lifestyle builds the disease or the prevention. So, believing there's nothing I can do because of family history is one of the biggest mistakes a man can make. Prostate inflammation can indeed be prevented, managed, and even reversed in many cases, regardless of your genes. You have far more power over your health than you think. Prostate inflammation doesn't just arise from age or genetics. It's also fueled, literally, by what we put on our plates every day. Let's talk about foods and drinks that are harming millions of men without them realizing it. First up, caffeine. Found in coffee, black tea, sodas, and energy drinks, it's a direct irritant to the bladder and prostate. In excess, it can worsen urinary urgency, increase nighttime urination, and promote local inflammation. Another major villain is alcohol. Besides dehydrating the body and concentrating urine, it interferes with liver function, increasing systemic inflammation, which indirectly but dangerously affects the prostate. Then there are ultra-processed foods. Processed meats like sausages, bacon, and ham. Industrialized fried foods. Fast food and salty snacks. Products with excess refined sugar, like cookies, cakes, and sodas. These foods stimulate the production of inflammatory substances in the body, such as interleukin-6 and TNF-alpha, which are directly linked to prostate enlargement. And finally, high-fat dairy products, like yellow cheeses and excessive whole milk, have also been associated with a higher risk of prostate issues in population studies. The good news is that you can start making smarter choices today. Cutting back on these villains is a huge step toward relieving inflammation and restoring urinary comfort. Remember, what you eat is talking to your prostate every day. Imagine a car parked in a garage for months. Over time, the tires deflate, the engine rusts, and the internal parts deteriorate, even without use. The human body works similarly, especially when it comes to prostate inflammation. Men like Frank, 74, who spend most of their day sitting, whether watching TV, driving, or reading, are creating an ideal environment for inflammation to thrive. Lack of physical movement reduces blood circulation in the pelvis, where the prostate is located. This means less oxygen, fewer nutrients, and more toxin buildup, all fueling inflammation. Additionally, a sedentary lifestyle increases abdominal fat, which is metabolically active and releases inflammatory substances. Disrupts hormone regulation, raising estrogen and lowering testosterone, an imbalance that directly affects prostate health. Weakens pelvic floor muscles, making it harder to fully empty the bladder. Studies show that physically active men have a lower risk of developing prostate enlargement and urinary symptoms. And you don't need to run marathons. Daily walks, stretches, and simple home exercises make a huge difference. Staying still isn't just a lifestyle. It's an invitation to chronic inflammation. Moving, even little by little, is one of the most effective ways to protect your prostate as you age. Among the most harmful habits for prostate health, repeatedly holding in urine is one of the most dangerous, and also one of the most ignored. Men like Edward, 69, often avoid using public restrooms or delay urination because they're busy. This seems simple, even harmless. But in reality, this habit creates constant pressure on the bladder, which directly affects the prostate. When urine is held for too long, the bladder overstretches, losing muscle strength. The urethra gets compressed, making complete emptying difficult. There's a risk of urine reflux into the kidneys, which can cause serious damage. Worst of all, the constant pressure contributes to prostate inflammation and recurrent infections. Urological studies emphasize that frequent urine retention is linked to a significant increase in prostate symptoms like pain, urgency, weak stream, and incomplete emptying. Your body is wise. When it sends the signal that it's time to urinate, it's not a whim, it's a physiological need that should be respected. Making a habit of responding to the first urge to urinate helps maintain a healthy bladder, a balanced prostate, and prevents complications that could drag on for years. It's a simple act. But in the long run, it makes all the difference. After decades of treating men like you, I've learned something powerful. The body has an incredible capacity for recovery as long as it gets the right stimuli. And the good news is, you don't need complicated or expensive solutions to relieve prostate inflammation. Small, consistent changes in your routine can bring significant results. Here are some simple, scientifically proven habits that help reduce prostate inflammation. Drink more water throughout the day. Hydration dilutes urine, reduces irritation, and improves urinary flow. Urinate regularly, don't hold it in. As we've seen, respecting your body's signals is essential. Reduce or eliminate caffeine and alcohol. Both are direct irritants to the urinary tract. Include anti-inflammatory foods in your diet. Cooked tomatoes, rich in lycopene. Salmon and sardines, rich in omega-3s. Extra virgin olive oil. Leafy greens and berries. Avoid processed foods and saturated fats. Additionally, moderate sunlight exposure, especially in the early morning, helps with vitamin D production, a crucial nutrient for the immune system and prostate health. Men who adopt these habits often report improvements in sleep, reduced urinary frequency, and greater comfort when urinating, all within weeks. Treating inflammation doesn't have to start with medication. It can start with conscious decisions made every day. If there's one natural, free, and highly effective remedy for prostate health, it's called movement. Men like James, 67, who started incorporating light walks into their routines, report not only improvements in urinary symptoms but also in sleep, mood, and overall energy. And this isn't a coincidence, it's science. Regular physical activity stimulates blood flow in the pelvis, strengthens pelvic floor muscles, and reduces systemic inflammation. These combined benefits create a much healthier environment for the prostate to function properly. Here are the most recommended movements. Daily 20 to 30-minute walks. Improve circulation, reduce stress, and control abdominal weight. Kegel exercises. Strengthen the muscles supporting the bladder and prostate, improving urinary control. Pelvic and hip stretches. Reduce muscle tension that can affect urine flow. Taking the stairs or light cycling. Boosts cardiovascular health and activates the lower body's metabolism. Movement also stimulates the production of beneficial hormones like testosterone and helps maintain metabolic balance, which further protects the prostate. No matter your age, starting is always possible. Even small steps matter. What counts is consistency. Your body was made to move. And when you move, all your internal functions, including your prostate, thank you. The worst attitude a man can take toward a health problem is inertia. Waiting for symptoms to disappear on their own, ignoring the body's signals, or believing it's just part of aging only speeds up the worsening. So if you've made it this far, it's time to turn information into action. Here's what you can start doing today to protect your prostate and regain control of your health. Observe your urinary patterns. Note how often you go, if there's urgency or a weak stream. This helps identify early changes. Adjust your diet, cut out inflammatory foods and start adding protective ones like tomatoes, greens, and fatty fish. Drink more water, spread it throughout the day. Staying hydrated is key for urinary health. Avoid holding in urine. Answer nature's call without delay. Add a light walk to your routine. Even 15 to 20 minutes is enough to kickstart metabolic reactivation. Reduce caffeine and alcohol, especially at night, to avoid nighttime urination. Do simple pelvic strengthening exercises. They improve urinary control and reduce prostate pressure. Seek medical advice if symptoms persist. The earlier the diagnosis, the easier the treatment. It doesn't matter if you're 62, 70, or 80, it's never too late to change. And the first step can be as simple as deciding to start now. Your body will feel the difference. And so will you. If you've made it this far, congratulations. It shows you care about your health and want to do your part to age with dignity, independence, and well-being. But knowledge alone doesn't transform. Action does. As a doctor with over 2 decades of experience in elderly health, I can say with certainty, most complications I see in my practice could have been avoided with simple, conscious decisions made years earlier. And that's the opportunity you have now. Protect your prostate. Take care of your body. Pay attention to the signals. And more than that, help other men like you do the same. Share this video with friends, brothers, neighbors, people your age. Comment below if you've experienced any of the symptoms we discussed. Your story could help others recognize the signs and seek help. And if you're not subscribed yet, hit the subscribe button, turn on notifications, and stay tuned for weekly content on health, prevention, and quality of life after 60. Healthy longevity is a choice. And you've just taken a huge step in that direction. Count on me in this journey.